NHS England saying a further 758 people who tested positive for coronavirus have died, bringing the total number of confirmed reported deaths in hospitals in England to 5,655, up from 4,897 at the same time on Monday. Let's just bring you the breakdown of how that's looking. Patients aged between 23 and 102 years of age. 29 of the 758 patients aged between 23 and 99 had no known underlying health conditions. Families have obviously been told. I was making the point, Ashish, that a week ago we had some encouraging news. We've got that weekend lag, so the Monday figures looked quite promising, but then Tuesday came along and you got a spike, and it looks like we've just seen a repeat of that.
Yeah, we have. Certainly we did with the figures in Scotland, and now it looks like we've seen the same with those figures here in England. Yesterday we reported that the increase in the number of people dying was 367. It's almost double that today, up to 758. And that is because, as you were explaining, there is a lag over the weekend. This is not a number of people who have died in the last 24 hours. It's a number that is released in the last 24 hours. So the data is collected, it's sent through to a central collection system, and then it's compiled and then distributed. So sometimes we see a discrepancy if you start adding up the numbers from England, Wales, Scotland, Northern Ireland, and then you have that figure released by the Department of Health for the national total later in the afternoon, about 4 o'clock. You will see there is a discrepancy, and that's because of the way the figures are collected and then sent to a central point, which then puts them all together. There is a delay sometimes in how long it takes to collect those figures and then put them onto a general database. But certainly we have seen what we think is probably acceptable to say that this is the weekend effect. We saw the same thing happen last week, so there is a pattern, and that's usually a smaller figure on the Monday with a much larger figure on the Tuesday. But still, and I suppose this is the critical thing, it's still too early for the government to look at these figures and decide whether a lockdown, a soft lockdown as it stands at the moment, needs to become much harder, or indeed it becomes looser, and then start allowing some normality to creep in. They will say, certainly the message is stay at home and save lives. They don't know whether the full impact of that lockdown is taking place, and it is being reflected in those figures. Too early to say yet, but we are certainly moving closer towards that.